Hello, everyone. Welcome to the 2022 open enrollment for Mathis Kelley. This is Curtis Friday with Keppel Healthcare Consulting. I'm here to walk you through some of the most important high-level parts of this year's open enrollment. Our office is here to help any of you. Our contact information is on the screen, support@keppelco.com, or feel free to give any one of us a call at 309-691-7900, extension 111. During this year's open enrollment, we are keeping our same plans with All Savers that we've had in the past. So the same plans with United Healthcare, All Savers, with the same plans. There was an increase on the rate, but Mathis Kelley has decided to pay that increase for you all. And so you will not see an increase when it comes to the medical. Everything that we talk about today goes into effect for October 1st. But again, even though we're keeping the same plans and there was a rate increase, your share out of your check should not change. Mathis Kelley is paying that entire increase. So I'm going to click continue here and get into the sections of the various sections of what we're going through. We are keeping our medical with United Healthcare All Savers. Our dental, vision, life, and voluntary life will all be renewing with MetLife. There is either no change or very little change in the rate. All of the plans will stay the same. So when we get into the personal information, please just make sure your information is correct. The main thing to note, because we've had you in the system now for a while, is if you've currently moved, please make sure your address is up to date. Same thing with phone numbers. Please just make sure that's up to date. Under the dependent section, your dependents, if you currently insure them and any plans should be shown. If you are currently looking to add your dependent to any line of insurance, you would click add. Anything with an asterisk is a required field. So keep in mind, you will need a social security number if you're looking to add a dependent to any plan. Mine are already loaded, so I'm going to click continue. When we look at the medical section, so under the benefits, we're going to have medical, dental, vision, and life insurance. Under the medical section, I'm currently enrolled as an employee. I waive coverage for my spouse or child. You'll see that the tool will continue to work where I can navigate and modify and change my selection, and the amount per paycheck will change based on my selection. If I look at the different plans, we have 3 different plans that are offered. We have a $1,000 deductible plan, a $2,500 deductible plan, and a $3,500 deductible plan. All plans are with United Healthcare. The plans have a difference in out-of-pocket maximum. The out-of-pocket maximum is when insurance will pay 100% of the bill. Even if you have your deductible in play, all of our plans have offices at copays. Those come into play without having to satisfy your deductible. So if you just go to the doctor's office, you would pay a copay, either $25 for primary care or $75 for specialists. You do have copays and deductible for emergency room. You have prescriptions. You cannot use CVS on any of our plans, so keep that in mind. You could go anywhere, but you cannot use CVS. And again, the deductibles are going to be the main difference between some of these selections that you have available to you. So once you know what plan you're going to do, you would select that plan if it wasn't already selected. So I just stayed in the same plan. I'm not going to make any changes. I can click continue. We do want to point out there's all kinds of resources with All Savers, United Healthcare. By being a member, there's things like Motion. You can get money by tracking your steps if you wear a step tracker. There's all kinds of pharmacy lists and wellness overviews and a ton of flyers to help guide you as a member of All Savers. So please feel free to take your time here, call our office with any questions if we can help guide you or if you need any help. The next step's vision insurance. There will be a slight change in the rate. You'll notice here per pay period, but the benefits themselves have not changed at all. So same MetLife benefits that we have. If you click plan details, you can see some of the high level benefits. If you want a little bit more information, you could click the benefit summary, or you can look up your provider by clicking on that lookup link. Our vision is also staying with MetLife. You will see here, same information as before. The rates were locked in, so no change in the rate, no change in the plan or the rate. Life insurance, we have a $25,000 basic life insurance that's paid for by Mathis Kelley, no cost to you. We are asking, there is some will prep flyers and other value adds that are included here, but that $25,000 of coverage is completely covered by Mathis Kelley, no cost to you. Please make sure you update your beneficiary or just make sure it's still applicable. We know divorce and life and changes happen. We don't want anybody to have an out-of-date beneficiary. Once you're done, you'll summarize your selection, make sure you looked at all of the right things, that you enrolled in the right coverages, you agree to this amount being pulled out of your paycheck for your various choices. Finally, you'll sign forms. First, you'll type your name, and then you'll sign your name using your mouse. And you'll do the best you can to use the mouse to sign the signature. Press down and hold that mouse, and then pop your signature on all the necessary forms. Once you're complete with all of the forms, you'll click Finish Signing and then Finish, and at that point you are complete. If you need to log back in throughout the open enrollment period, you can always click on your benefits or documents and look at all the different documents or benefits that are available to you. Please do not click the Manage Enrollment button unless you're willing to go back through and re-sign off on the application. If you have any questions, feel free to call our office. Again, thank you so much. And if you need anything, please don't be shy to reach out to our office. Thanks.